All right, I guess we are live. So fantastic. Hey, if you're joining us this morning on the West Coast and this afternoon on the East Coast, my name is Nathaniel Darnell. I'm a former EMT, emergency medical technician. I spent many years volunteering as a free foot care clinic for the homeless, and spent even more years serving as the vice president of a nonprofit diabetes education and outreach organization. And during all of that time, the most important thing that I learned was how important basic nutrition is and what happens to the human body when you don't have it. And the reality is that life is complex and it's not easy when we're exposed to all kinds of extra chemicals and hidden sugars and overprocessed foods. But I made it my mission after witnessing so many of these challenges to find a way to help people eat better so that they could live better. And along that journey, I had the great experience of meeting a now wonderful friend, Dr. Howard Cohn, who long before I was thinking about these things, was already thinking about them and was already figuring out solutions. And currently he resides in Southern California. He runs the Cohn Health Institute, a world-renowned organization that has a waiting list of over a year just to see patients. So he's very sought after and very experienced in this industry. And it's really our privilege to have him on today's nutrition-based call for the Seacret Company. And I'll introduce him in just a moment. During this call, what we will be talking about, if you're new to this call, we'll be going over his really great concept of something called Health Made Simple, and how that came to be and why he really recommends this program. Then afterwards, we'll be talking a little bit about a brand new product. We'll be doing a product spotlight on a product called Probiotics. And then we'll answer a couple of FAQs, and then we'll close up the program. So with all of that in mind, I hope everyone can hear me. And Dr. Cohn, thank you for being on this morning's call. And I'm going to hand the microphone over to you so you can share with all of those on this morning's call what the process is, or what the concept is behind the Health Made Simple program and the basic number of products that go into that. And then at the end, then we'll tack on probiotics and talk about how that kind of fills in the gaps.
Well, thank you, Nathaniel, and welcome everybody. I know that everyone's busy in their lives today and most days these days, and really appreciate your time, and hoping today will add some value for you, your family, your loved ones, especially with your health, which is now at the forefront, if it wasn't before, of everyone's lives, whether we want it to be or not. And so we are going to highlight our probiotics today. I know each and every time we try and do one of these calls, we try and spend a little more time on one of the products. But if you're brand new, welcome. If you've been around for a little bit, welcome as well. And I'm sure there are just an endless amount of people that have great and amazing stories about what's happened for their health with this Life by Seacret product line, especially our Health Made Simple program. And I'll just spend a few minutes on it just to bring everybody up to speed. This program is designed to really fill the gap for everybody and anybody within their diet, between what they're getting and what they're supposed to be getting. Not everybody believes that we need to supplement our diet, but as you were alluding to before, Nathaniel, there's so many things that are affecting our health now more than ever, that if we do not build a guard at the gate with our health, with our immune system, with our gut health, with our cardiovascular system, with our nervous system, with our stress response, and all the different things that are diet, nutrition dependent. It's not if, it's when we will fall to all the different things that affect us on a daily basis, which we could literally spend hours and days talking about just to doom and gloom it all. But we are going to keep it as positive as possible today and share with you solutions and sources of nutrition that we have. So again, nutritional supplementation is designed to fill the gap between what we're getting in our diet and what we're supposed to be getting. And for some of us who really have spent a lot of time and energy researching on what we should and should not be eating, exposing ourselves to, that gap is narrow. But for many of us, that gap is huge. And it's not if, it's when, as we say, if we don't do something, it's going to happen to us. So that's where it all started. You know, in our office in the Cohn Health Institute, we have over 2,000 different nutritional products from 100 plus companies from around the world, always wanting to make sure we had exactly what people needed when they came in with all the bizarre things that they come in with from all the places they've been around the globe. And so this product line is the genesis of the realization that, man, if we could have just got people to do a handful of things early on, then they wouldn't be in my office. They wouldn't need to be, because they would have prevented the majority and the lion's share of things that affected them. And so when we looked at all the different things that were affecting people's health, it came down to this, is that we could live a month on average without food, a week without water, but we cannot live 6 minutes on average without oxygen. And where do we get it as humans? Is from raw green foods, from chlorophyll within plants. So where do we get the most dense, concentrated plant nutrition from? It's from our cereal grasses, which are wheatgrass, barley grass, oatgrass, with all our green vegetables, broccoli, kale, all these different things that produce oxygen so that we have this great symbiotic relationship. Now more than ever, people are making themselves devoid of oxygen based on things they're wearing over their mouth. So we got to have greens. We just got to have greens. That's where it started with our greens powder, which is, again, organic, which is raw, which is not like anything else on the market. We'll spend other calls on each and one of these products. We have greens in capsules too, because some people just don't like anything in a powder. So that's where it started. The next thing was in our Health Made Simple. That's half of step 1 in our Health Made Simple program. The other half is our protein shake. Now, again, the world did not need one more protein shake, but what they needed was something that everybody would do, whether it's a young teenager all the way to an adult or a senior, that you could do so many different things with, which tasted amazing, that was organic and gluten-free and dairy-free and soy-free and nut-free and nightshade-free and free of all the junk that we don't even know we need to be free of, that we expose ourselves to in all our diet. We wanted to make sure that people got a meal every day that they could have once or twice or 3, or if you're a bodybuilder, up to 5 times a day if you so wanted to. And that was our shake. So our shake and greens, which mix perfectly together for using the powder, is step 1 of our Health Made Simple program. Step 2 was looking at the fact that, by the time people realize they need to do something about their health, they've already oxidized a little bit. They've aged. And we looked at the different things in the world that were antioxidants, but they seem so slow acting. And then when we had this epiphany and discovered serendipitously the miracle of molecular hydrogen, and then with the help of some very brilliant scientists, we're able to be the first company in history to actually have a product that you can ingest, where you don't have to depend on drinking it from water or depend on having it in a tablet you need to dissolve in water, but you could actually ingest it and have it in your body right away. It's what I believe is the world's fastest antioxidant. It's the #1 most used product in our office, the #1 most used product at Seacret, and is what we call an impact product. An impact product is something that you can take and 9 out of 10 times feel right away. So if something's hurting, you're not performing well, there's literally hundreds of different things that molecular hydrogen has been studied for. I encourage you to go do your own research about all the magic behind this property. But having the company that has the product that you could just put in your mouth and start working right away, where it releases nanobubbles in seconds that you could absorb, there's nothing like it on the market, which is why it's so popular and it has so many uses. So that's step 2, because you know what, we have to play catch up. As we say, it's never too late to have a happy childhood. So if we got a late start in the health game, doesn't mean we have to end badly. So we could catch up, and that's what we do with our recovery. People say, what does it do? Helps you recover. They say, from what? I don't know. What do you need to recover from? So there's so many different things that it's used for. Again, I encourage you to do some of your research on your own of that. There's a lot of great resources out there for you. I know Nathaniel has been an avid historian and researcher over the last decade on molecular hydrogen and minus hydrogen ion and all things hydrogen. So he has been a great resource. So definitely follow him on all his forms of social media, as well as information that he's put out over the years. And then step 3 came out of the realization is that it doesn't matter what I say. People are still going to eat the junk they eat, drink what they drink, do the things they do. And as we say, if you're going to do the crime, you got to do the time. If you're going to beat your body up, you can't believe can't just think it's not going to have a long-term effect. So we created something called our boosters, originally called our alkaline booster, which is bicarbonate and carbonate minerals. They'll boost your body back to an alkaline state. So not only is it the foods that we're eating that are just wrecking our bodies, it's the emotional stress we're under. They say the greatest acidifier is actually emotional stress, worse than your diet. And then if you look at the statistics at 2020 into 2021, never before has there been such a rampant epidemic of emotionally related situations. I think unless you've been living under a rock for 2 years, I don't have to tell you why. Depending on where you are watching this in the world, some of you guys are under way more stress based on how where you're living is operating in the world versus how others are. But then again, it's an inside game and it's an acidifying situation. And if you're running hot, your body goes into sympathetic overload. You can't sleep, you can't digest, things aren't working right, your body starts to malfunction. If you move yourself to a parasympathetic alkaline healing state, then everything seems to magically right itself. So this combination of our shaking greens in the morning, our recovery during our day, and our alkaline booster or our booster at night is that trifecta, 4 products, 3 steps, super simple, cost effective, tastes great, organic, and works fast. So that's our Health Made Simple program. And there's been a host of other products that we've introduced to help stack, or what I call biostack, to have each product work better and better. It's kind of like if you have a guitarist and then you have a singer, it's the band's better, and you throw in a drummer, it's better. You throw in a bassist, it's better. And then now you start filling out the, a saxophone and a trumpet and all these different things. Next thing you know, you have an orchestra. And that's what we have with the other products we've added to our line, whether it's our Munex, or it's our DigestX, or it's our other great products that we've added, our Curb, our energy, our Seacret energy product, and what we're going to be talking about today a little more, which is our probiotics. So before we get into that, Nate, I'll throw it back to you if you want to add anything to what I've said or correct anything.
Certainly. Thank you, Dr. Cohn. The only thing that I really like to share is that the Health Made Simple program that you put together, while it may be very convenient and practical, from my perspective, the most important aspect was that it was following the peer-reviewed longitudinal research long before these things were really ever paid attention to by current healthcare professionals. It was years ahead of the plant-based movement. It was years ahead of what became known as the hydrogen movement. And I just want to thank you for always thinking several steps ahead of everyone else, because we really want to head these things off of the pass. Where do you, if you really want to be successful in hockey, right, you go to where the puck is, not where the puck has been, right? So to that end, I just want to acknowledge you for always being ahead of that curve. And as you shared, that's been kind of my focus in the background, is making sure that all the science marries up with the actual products. And so I was really amazed when I discovered your product line, knowing that you'd already done a lot of these things. So to that end, yes, let's talk about the probiotics product that was just recently introduced, and this is a probiotic. Now, over the past couple of years, there's been a tremendous amount of research around what's known as the gut microbiome, or simply microbiome for short, and that's the internal terrain of the bacteria that's in our digestive tract. And unfortunately, over time, this can be disrupted. If you think about a lawn or a yard or a crop that has organic vegetables that are doing really well, if you don't feed those vegetables correctly, or if you damage the soil, then what happens is that weeds start to grow, plants that are not good, and they begin to push out all of the good plants. And what's happening in modern times is that we're consuming artificial sweeteners that do an injustice to the good bacteria that's in our gut. We're consuming lots of antibiotics, whether intentionally because we're taking prescription medications, or because we're consuming meat that has trace amounts of antibiotics in it from factory farming. That also disrupts our gut microbiome. Or simply consuming chlorinated water disrupts our gut microbiome. Or just taking a shower in chlorinated water can be the equivalent of consuming 8 glasses of chlorinated water. So there's a whole host of outside factors that are disrupting our bodies that the average person isn't aware of. And they're not familiar with the idea of taking good bacteria to help reestablish that those good bacteria in the stomach lining, which help, and in the intestinal tract, which help to create additional vitamins for the body, which help to prevent those other weeds, for example, from growing. And so with that kind of basic understanding, the current research suggests that not having good bacteria can cause a host of problems, from added weight gain to mood disorders to intestinal disorders. And so I was really excited to learn that you were going through the process of building and developing a product for here at the Seacret community, specifically as an add-on to the Health Made Simple program. So I'm going to hand the microphone back over to you, Dr. Cohn, and you can talk about this probiotics product.
Well, thanks, Nathaniel. And yes, I'll definitely cover some basics about the products again with each and every one of these products and the reason why it was created. There is a whole backstory of how we can't live without it. The one thing I want to add is that at Seacret, we're never going to create a product that there are 1,000 Me Too's to. We're not going to create a product that maybe some people need. We're going to create a product that everybody needs. Otherwise, there's no reason to create it. And there's so many other resources for it. And you can just log on to Amazon and go grab something. So if that's all you're interested with your health or getting your nutrition from a big box store or whatever you're doing, then this is not for you. If you're interested in something that's going to move the bar, shake things up, have something where you have a shift in your health, then these products are for you. And this Probiotics is one of them. Here's what it looks like. We wanted to kind of disrupt or shake it up a little bit. So different than one more pill. People get pill fatigue or capsule fatigue. It comes in a convenient packet. Now, maybe you can see that. You can just tear it off, put on the tongue, tastes great. Kids like it. It's recommended for kids 4 and above. That's what we say on the label. There may have been kids that under 4 that have taken it, but that's on you. So, but always follow what's on the label. It tastes amazing. It's organic, which is something you kind of never see in a probiotic. So that was another thing that we did here. The other thing too is we really went through 80 plus different strains. I mean, there are many different kinds of good bacteria, so to speak. There's many kinds of bad ones too. But we went through them to have the most diverse and comprehensive that also work together and then together seem to uplift the effect of each one. Very rarely do you take a probiotic and you feel it, but this is one of those products you feel right away, which people absolutely love. So probiotics, for most importantly, the 2 biggies, which is why people take probiotics, is their gut health and their immune system, and to help assist in their normal function of their immune system. As well as there are strains in here, as you research them on your own, that you can see that they've been used in cardiovascular health, mood disorders, nervous system health, dental health, respiratory health, and so many other things. So we wanted to have something that was comprehensive, something that everybody can take, and that was easy to use. Also, it doesn't matter if you have 50 billion of the wrong ones for you. It's great if you have a lot of the ones that work and work synergistically, which what we have here. We have 20 billion, 6 different strains, and again, super simple and fun to take. You'll see all over the internet and social media, kids taking these products, loving them, asking for them every day, even big kids, even gray-haired kids like us, or me, not you, Nate, you're looking good. So, but after this a little longer, I got a late start. So in any event, I know we have some questions on it. I could talk about it forever. Maybe we could address some of those.
Sure. So let's do a couple of things first. Number one, this is a very unique product. And I think those watching this program really need to understand that. Number one, it's in a quick melt format. So that allows you to directly ingest it so that it can be rapidly absorbed by the body. And the bacteria that are actually used, the positive bacteria, are acid resistant. So they can make their way directly through the stomach and into the small and long intestines, large intestines. right? And even make their way through the mouth area, your gum line, all of those things where most people don't realize it, but bacteria gets pulled into those areas too. So it's a really comprehensive design, plus it doesn't need to be refrigerated. We're using a very unique technology, which allows these bacteria to be shelf stable for up to 24 months. And that allows you to travel with these and not have to worry about refrigeration. So you can send the kids to school with these things. You can go on road trips with them and not have to worry. You can travel. And I really think that's incredibly convenient for those, for modern families. And so to that end, it also has a flavor profile. So it's really tasty from my understanding, at least from the kids, and getting them to eat anything is a challenge, unless it's got a lot of sugar in it, right? And this doesn't. So that's the most incredible thing, I think, was actually the flavor profile. But yes, we did get some questions, FAQs from the field, which I think that we should address during this program. And the first one you kind of already alluded to, Dr. Cohn, which is what age group can take this product? And I know you mentioned the age of 4 for legal reasons, basically 4 and up. But, you know, is there a limit? I mean, how old can you be to not take it?
Well, you can take it at any age, and it's fun to take, as we said. So you want to be at least 4 years old. That is the legal at this time age that these strains have been studied for. And although you see probiotics taken by children younger, and you may even see these strains of probiotics taken by children younger, we at Seacret, for legal purposes, have to say 4 and above. If you want to consult your healthcare practitioner that takes care of your kids, or gives you advice, and you get other advice, then follow that advice.
All right. In terms of daily consumption, is it recommended to take daily, every other day, once a week? I would personally take it every single day, but that's me.
Yeah, it's recommended to take daily, 1 packet a day. 1 packet a day is sufficient for most people. You know, some kids take half a packet if they're super young, like 4 years old, but most 4-year-olds take the whole packet. And there are situations where some people take more than 1 packet, but we recommend taking what's on the label. If you've had, you know, high dose antibiotics, if you're working around in an environment that is where you're exposed to excessive pesticides, herbicides, fungicides, if you're working in an environment where you're around a lot of
toxic people,
EMFs, or what did you say?
Toxic people.
That's what I thought you said. That's hilarious. I can't comment on that, but that is hilarious. I haven't done the research on toxic people's direct or indirect effect on microbiome, but I'm sure there's an effect. But I was alluding to the electromagnetic frequencies of Wi-Fi, Bluetooth, all the different things that we get exposed to from electromagnetic standpoint, 5G, that our body's not used to, where your microbiome has starting to be shown sensitive to these forms of radiation, and they accumulate. So again, so many reasons to take it. Probably the biggest one where people take more than 1 would be antibiotic use and post-antibiotic use, because not only is the good bacteria wiped out of your bad bacteria wiped out of your body, many times a lot of the good is as well. And I think it's pretty common knowledge that people should take probiotics after. And I'm just got to be honest with you, for most people, your yogurt is not enough.
No, it's not at all. It's basically calcium custard. What most people don't realize is that it has to be pasteurized before it's even sold. So what does it do? They kill the bacteria before they put it on the shelf. There's very little live bacteria in the yogurt. It's basically calcium custard. Most people don't know that.
That's true. That's right.
So to that end, okay. So we had another question we kind of addressed a little bit earlier, which is, does stomach acid affect the bacteria that are in the probiotics product? And I answered that a little bit. You're welcome to add on a little bit more if you'd like, but my understanding is that these strains that were selected were specifically selected to be acid resistant, meaning that they were robust and they were intended to be able to transit the stomach and then to make their way into the small intestine and large intestine so that they could do their good work there.
So Yeah, really just to reiterate what you said, they're acid resistant, which many are not. And then the other thing too is that depending on where and how these are made, there's a lot of secondary and tertiary um, manufacturers of probiotics. We went right to the number one probiotic manufacturer rather than try and get it done at other places that we've had great success making our greens and shakes and other places. We went straight to the ones that do this thing all day long, every day, and got with them so that we would make something unique just for Seacret agents here. And that is what you have. So where there's no middleman of or middle person or whatever makes everybody happy, that will get these right to you, but they are made in such a way and they're housed in such a way and treated in such a way where they're just ridiculously anal, as far, no pun intended, as far as how they test and retest and test at the end of the cycle to make sure that what they say on the label is in the box.
Sure. Now, another aspect of this product, which I found very novel, was the fact that it actually includes prebiotics with the probiotics. And for those that may not be aware, prebiotics are basically the lunchbox for the good bacteria. If you're going to send astronauts to Mars, they need their own food supply, right? And that's essentially what's been done with this product as well. Can you add to that, Dr. Cohn?
Yeah, I mean, you know, if you have crappy soil, it's hard to grow anything. If you have good soil, it's easy to grow something. And really, the prebiotics are analogously, it's not an exact analogy, but they make it so that the probiotics have a good environment to grow in, to stick in. And it's also stickability. It's not what you eat, it's what you keep. So the ability of probiotics to navigate in our gut and increase the health of our microbiome where it's measurable is directly related to the kind of prebiotics that you seed your gut with. And so not only is our prebiotics from inulin, from Jerusalem artichoke, but it's organic as well. And so again, nothing but the best to make sure that we have, again, not just great on the label, but great, more importantly, in the gut.
So what's the difference for those that may not understand the difference between probiotics and Digestex?
So we probably should expand the conversation to talk about probiotics, Digestex, and the boosters, because that was a much more common question I had at the last Seacret training. Of what to take when. And so, for example, we take the Digestex, which are digestive enzymes, with our meal because when we eat a meal, the majority of the time it is cooked. And we cook it above 118 degrees or 40 some odd degrees Celsius. What happens is we start to destroy those enzymes, and those enzymes were there to help digest the food and break it down so that we can absorb it and pull energy from it for our bodies and our tissues. And if we destroy those enzymes because we've cooked it or microwaved it or whatever it is, they're not there anymore. So we don't necessarily get full value out of our food. So it's so important to take digestive enzymes when you do eat food, especially cooked food. And then the alkaline boosters, or the boosters, are designed for when, regardless of which enzymes you took, if your body's stressed out or it's just not working properly or digestive system's broken down or in recovery, that it will still produce this gas from undigested food that maybe the Digestex knocked down for you, but didn't knock out. And that's where the buffer is of these boosters, the minerals and boosters, to help as what we call right on the label, the hall pass. It's kind of fills the gap for you. It's like an insurance policy to make sure that your body will not be an acid overload, which again sets us up for a variety of different health issues. And then the probiotics is because of the destruction of our gut from the variety of things we talked about. We really need to put the good soil back, which is where all of this starts. So there's like a 3-tier program for your gut. So we take our digestive enzymes when we eat, our DigestX when we eat. We take our alkaline booster or our boosters before bed, which is the best time to take them. You can take them between meals during the day if you need more help, but most of us during the day. And then our probiotic you take, ideally, it depends who you read and what your experience is. Most people also take them before bed with their boosters. Many like them in the morning instead, so they do it at a different time. They feel like it's better for them. Again, trust your body. It works in the morning, works at night, better on an empty stomach. And most, although like all humans, there's a handful of people that do better when they take them with their food, but most do not. Most better on an empty stomach, preferably at night, some in the morning. Hope that helps.
I think that was fantastic. Thank you for clarifying all three of those products and how they work synergistically. You know, the term that we normally use for both prebiotics and probiotics together is symbiotics. So some of the people on this call may hear that term moving forward. We've got one last question, and then we're running short on time. So I think I'll just grab and run with this one. And the question is, what is the difference between probiotics and other probiotics, the product that you've helped bring to market, and then other probiotics available like at your local grocery store, so on and so forth? And I would like to point out those things that we've already discussed. That number one, we have a select number of strains that are specifically designed to cover a very wide age group. They're designed to be shelf stable for up to 2 years. They're in a very unique powder format that can be delivered in a beverage, in custard. You can put it on your soup. You can put it, in a drink and consume it. You can put it right on your tongue. It's a very, very unique delivery system that children find incredibly fun. And that's incredibly important as a parent, if you're trying to get your children to eat the right things. And then the fact that they're acid resistant, make sure that they can actually do the good work that they're supposed to do with the prebiotics included, so they have that sticking power that you just discussed. Now, what I guess in closing, is there anything else that we should talk about? I think there was one question about what it's the age group, but we already discussed that. 4 is simply there because it's the legal requirement for right now, in terms of as the youngest group that can actually take the product. And my opinion is that people should be consuming this once a day, every single day, forever. That's what I do because I'm familiar with all the things that we're exposed to. There's never a day that goes by where your intestinal tract isn't assaulted by something. So, it's kind of like just doing the good work in the garden every single day, to keep it growing as best as it possibly can. Anything else that you'd like to add, Dr. Cohn?
Nothing other than the fact that we've been beating this drum for a long time about how important your health is. And it's a whole lot better to be proactive than reactive. In Asia, they say, don't wait till you're thirsty to dig a well, which means it's easier to stay well than it is to have to get well. So many health conditions start with the breaking down of your digestive system, your gut, your elimination system, and probiotics, especially probiotics that are organic, that are these kinds of strains, really help add and keep some of the guard at the gate for you. There's no room for error anymore with people's health. Too many people have succumbed, so to speak. Although we do not make any medical claims about these products, they are not used to treat, diagnose, or mitigate any health condition, diagnosis, disease. They are designed to give your body the food it needs so that it can function the way it was designed, which is all our products and all our future products will be under that same philosophy. This is why we're a health company and not a disease care company. And so I look forward to your good health. And Nathaniel, thank you for taking the time. Appreciate it. I know you're busy. Definitely everybody follow Nathaniel because he's just pumps out great information all the time. Where can they find you, buddy?
Well, they can find my public page at dreamactlead.com. That's spelled like dream, and then the word act and then lead, because you've got to have big dreams. You've got to take action. You got to step out front and make it happen. And that's really the fundamental concept there. So to that end, always remember that if you ignore your health long enough, eventually it will go away. And secondarily, healthcare starts in the home, not in the hospital. And during our next interview, Dr. Cohn, we're still trying to anchor that date, but we'll be discussing HydroFX and the importance around the minus hydrogen ion and its antioxidant power and calcium benefits. So stay tuned for that. And until that episode happens, this is Nathaniel Darnell wishing you well, and we're out.
Bye, guys.